Hey, everybody, welcome to Resiliency Radio, your go-to podcast for the most cutting-edge insights in integrative and functional medicine. I'm your host, Dr. Jill, and with each episode, we dive into the heart of healing and personal transformation. You've seen us, we've got amazing experts from all over the world, and today is no different. I have a new guest that I haven't gotten to know yet, but we're going to get to know him together. But I'm so excited about this topic because who knew that an infectious tick-borne disease could have anything to do with breast cancer? Stay tuned. We're going to learn all about it from Dr. Oertle today. Let me introduce my guest and then we'll get right to it. Dr. John Oertle is a leading expert in advanced precision medicine. He's the chief medical director at Invita Medical Centers, specializing in individualized outcome-based care models for chronic disease and integrative oncology. He is well published in cancer genomics, immunotherapy, and chronic Lyme disease. Welcome, Dr. Oertle, to the show.
Hey, great to be with you, Dr. Jill. Appreciate it for having me.
Yeah, I said when your publicist or whoever reached out to me to ask me about being on the show, I was like very intrigued. First, before we talk about infections and cancer and the connection, let's talk about your story. So you are a naturopathic medical doctor. Tell us your journey into medicine and how you got intrigued by the topic.
Oh, yeah, I love to share. So my story begins when I was 10 years old when I got diagnosed with type 1 diabetes for the first time. And my mom was amazing. She's a superhero in my life. She could see and read the signs. She wasn't even medically trained. She's just a superhero mom that actually saw that I was having, active thirst and urinating quite a bit when we went to the park for my brother's birthday. And, before that evening ended, she was at the pharmacy buying glucose strips and testing my urine for sugar. Interestingly enough, I was sky high and I got into the doctor the very next day. And so what was beautiful is that I started learning about, even at a young age, it's a hard diagnosis to be able to get it for my mom and for, it's just tough when you're dealing with kids. But for me, what it did when I experienced it firsthand was I fell in love with the medical system. I fell in love with biochemistry, how in my body was working and the way that I could actually influence my body depending upon what I did, but depending upon my diet, depending upon my exercise, depending upon how hot I was or how cold I was, all had an effect on my own glucose levels and sugars. So I love this. And so this is really what gave me this desire to be able to go into medicine of some kind. And my mom was always big into holistic and functional medicine, even way back then. And so this is where I was always interested in all these other areas. But it wasn't until I was in college that I was to get my pre-med at ASU, go Sun Devils. But I was getting my pre-med and um, I transitioned from my pediatric endocrinologist, who was very focused on prevention, doing everything we could possibly do to be able to keep me well and healthy and really tight glucose control. And I remember again going into my adult endocrinologist, and I'm sitting in a waiting room of people who are, again, they are, amputees, and they have, they're blind and they're being led around by their caregivers. And I thought, I don't want to turn out like this. And one, I feel like a young kid. I'm healthy. I'm in like sardines in a waiting room. And then I remember going back and getting called in and talking to the doc, and he spends like, a couple minutes with me, and he's like, "You're doing great. I look at your labs, you're doing actually absolutely excellent." He goes, "Keep up the good work." I go, "Well, thanks, doc. But, I'm also wondering, is there anything I can do to be able to be better? Is there anything that I can do to prevent this disease before it begins?" And he takes out his script pad. He goes, "Absolutely, there is." And he gives me a script of lisinopril. And he gives it to him and he says, "This is what you should take. It's a high blood pressure medication, but it's going to protect your kidneys." And I go, "Well, doc, I don't have high blood pressure." He goes, "That's right, you don't, but it'll protect your kidneys nonetheless." And I thought, okay, hold on. And so anyways, I ended up going out of that office really disappointed that day because I thought there's so much better if medicine that can be done. And I remember as a young kid and just being disappointed with the healthcare field and that there could be better. And I knew better because I practiced it even as a young person and had talks and conversations with all my docs who really cared about these things and cared about biochemistry. And I thought, I'm not deficient in lisinopril, but I do know that there's things that I can do to be able to actually help protect and even be better as far as protecting the tissue. What are the biochemical pathways that are going on that are actually creating these disease processes within diabetics. And so that's really where I started to be able to get into. And I remember, frankly, again, the week later, I had a deep dive conversation with a naturopath here who was and now has become my best friend, the founder of Invita Medical Center, and the people that, again, now who I'm the chief medical officer with. And we deep dived on exactly this concept of what can we do to be better, prevention, and going into the world. So that's where I started jumping into naturopathic medicine, and and then eventually came to work here at Invita Medical Center, and the rest is history. Now that I'm the chief medical officer here and overseeing all the medical care that we're able to provide, but it's really for that ability of looking at root cause and precision medicine, looking at the best of options, chemotherapy, natural agents, root causative medicines, all this ability to be able to look at precision to really make sure outcomes are reigning supreme for patients. And so we do this at a high level for both autoimmune conditions, neurodegenerative, specifically looking at infections and other carcinogens and toxicities. And we do this with precision methodology within our cancer treatment protocols, which are just been phenomenal to be able to actually look at these root causes and targeted treatments to be able to make sure outcomes are reigning supreme.
Absolutely amazing. And I always love most of us who are in this kind of field of precision, personalized, functional, integrated, which is all kind of one of the same bubble, right? We all have a story. And if it isn't our own journey through health and illness, it might be someone we love that we weren't able to see in the traditional sense, the answers, just like your story. Mine was very similar. And I don't always share my story, but just briefly because it's relevant to your topic. When I was 25 years old in my third year of medical school, I found a lump in my breast. And I was diagnosed a few weeks later as the youngest one in Loyola, Chicago, ever to be diagnosed with breast cancer. That was 2001. So now there's been a lot of people that young. It's not that rare, sadly.
Anymore,
But,
yes, the younger
right?
than 50 that are being diagnosed with all types of cancer is on the
Right,
rise.
right. And you see the exponential curve, but all that to say, it was a very real awakening and part of my own journey where I really said, okay, why, right? What we do as functional, integrative, personalized precision medical practitioners is say, well, why did this happen? I grew up on a farm with things like atrazine and chemicals that are endocrine disruptors. I was absolutely exposed to ticks and I was diagnosed with Borrelia, Bartonella, Ehrlichia, and Babesia, and probably more like atypicals. Anyway, all of that has something related to our topic today. And I'd love to know what you see. I always think about, as we framed it, the infectious burden and the toxic load, and these things affect our DNA and expression. But many, many people out there are going to be shocked to think about could a tick vector-borne infection create a cancer? Could a toxic load? And you and I know that, but why don't you frame it for us as far as when you see a cancer diagnosis, and maybe in particular breast cancer, what things under the hood of the car are you looking for as possible causative factors?
Oh, it's so good. Yes, I would love to. Because so we've been doing this work for 25 years. My good friend that I talked about, Dr. Dino Prado, who's a brilliant man, going into this field because he wanted to make sure patients are getting the best of the best and outcomes are able to be identified. And then we're able to stop at nothing to be able to get the very best treatments for these our patients that we actually are treating. And 25 years ago, he began. And what we've been seeing in our data sets is so clear that, again, I like to share that, again, you don't just come down with cancer, even if it's just genetic causes. And let's talk about that. Like BRCA1, BRCA2. Many people are familiarized themselves with this. Or when it's a hereditary cancer, that actually accounts for a very small portion of the population. Even BRCA1, BRCA2 is still a very small percentage of the breast cancer population. I even say, though, that even with BRCA1, BRCA2, even if it's positive, it does not mean that you as a patient, if you have BRCA1, BRCA2, that you will develop breast cancer or ovarian cancer or prostate cancer or pancreatic cancer, which is all correlated with.
Yeah.
But it does say that, again, it's essentially that you are at a higher risk for the development of it because of these epigenetic factors, these things that are stresses upon the body that are shifting our signaling, shifting our genetic mutations that then start to be able to create either, I like to be able to say, a runaway truck effect because the cancer suppressor genes are not, that the brakes are no longer on the actual car, and this starts to cause rapid growth. Or you have genes that are proto-oncogenes that are actually increasing the speed. And so your body can't contend with that rapid production of cells. And so this is where both of those are dynamics as far as that could be the way the genes are mutated. But then the other thing that's with it as well is that even if a gene mutates and you have a cancer cell that starts to grow, every cancer patient has an immune system error,
Yes.
or the immune system has not been keeping it in check, because you and I have genes that are mutating all the time. All the listeners have genes that are mutating all the time, but our bodies have this amazing thing called the immune system. And this is what actually allows the body to keep these cells that are going off track, that are abhorrent, that start the gene mutations that start to grow, that it starts to keep it in check, to be able to say you're a disease cell, so your immune system keeps it in check. And so this is where it's really every cancer patient has an immune system that is not working the way that it needs to work. And that starts to go into, okay, what's the actual pathophysiology? Why is the case? Why did the cancer begin in the first place? And why did the immune system not keep it in check?
What a great, great analogy. There's another part of my story that'll make total sense to you. And this was probably 10 years ago. I was diagnosed with common variable immune deficiency, where I do not produce IgG appropriately. Now, looking back, I'm like, I wonder if this preceded the cancer. And then again, did toxins and infections lead to a manifestation of an immune deficiency that was well before I was ever diagnosed with cancer? But it's interesting to think about these things in that circular way, because I was diagnosed way later after my cancer with the immune deficiency, but I think it probably preceded the diagnosis. So let's talk about, say a woman comes in and she's, 35, she's young for breast cancer. What do you do for a workup? What are you looking for? What kind of testing do you do? How deep do you dive? Give us kind of a glimpse into what that looks like.
Okay, so we go very deep, because even this is where, and I love this. I always ask all my oncologists or people that are going on tours with me in our actual programs, or business leaders talking about this, if I would love to be able to have an oncologist talk to me who is literally, when a cancer patient comes in their office, even if it's an early stage, even let's say breast cancer, what is the oncologist that's looking for root causative factors?
Yes.
Okay, this is where I think what's really interesting, we see this in our society. Everybody likes to talk about carcinogens, or even this, and it's lesser talked about, but again, it's really, even a carcinogen is a chemical substance that causes cancer.
Mhm.
This is where there are infections that are oncogenic infections, infections that cause cancer. Again, we're aware of things like HPV causing cervical cancer. Praise God that we've been identifying that, because that's been probably the most successfully treated cancer in the last 20 years. And the reason is because we actually have identified that HPV, which is a virus, actually causes the cellular changes
Mhm.
in an actual cervical cancer cell to be able to cause cancer. So praise God for that. And now our screening techniques are different. But we can do the same thing. We see these correlations in breast cancer, or pancreatic cancer, or prostate cancer, you name it, where you start to be able to see these carcinogens and oncogenic infections that are correlated to the disease process. Now, what I will say is this, is that I'm in Scottsdale, Arizona. But if you go over to California, you go into a Starbucks, there's a law that says that you have to be able, as a business, you have to list off all the places where, if you're a business, if you have known carcinogens in your environment, and if your products and your clients are exposed to this, you need to say, this may contain known carcinogens. So you
Right.
go to Starbucks in California, and you'll be sucking on a Starbucks cup that says this place may contain known carcinogens. I think, well, okay, this
Yeah.
is good. It's good to know, and awareness is important. But why is it that in our current conventional system, when you go see an oncologist, you can have a breast cancer and you can get it removed? Again, even early stage, why are we not looking for root causes? And I
Yeah.
would say it's similar to, if we aren't actually taking the gasoline off the forest fire, then this is where the actual risk of, even with a breast cancer, right? Again, some of the statistics right now with some of the breast cancer is that even if you have it removed early stage, 30% of them do come back.
Right.
And just because, even that's with clean margins. So you don't want to just be those 30% to be able to say, let's just celebrate without actually knowing, okay, what's the reason
Yeah.
for why this cancer began? Because if we then know it, we can actually then treat it and become healthier, and
Yeah.
actually make sure that the immune system stays healthy, that the actual cells stay healthy. I mean, you're a dear young girl, and you have a whole life to live. And this is where I say that for young people, but I also say that for my
Yeah.
65-year-olds that's coming on in, because guess what? With the current, you should be living again well into your 80s, at least
Yeah.
80s, and maybe again over 100. And so this is where you still have so much life to live. Let's actually live with good quality of life and actually evaluate that disease process. So To your point, when we have a case that comes on in, we are running the various carcinogens. We're looking at one, we take a full intake to be able to actually evaluate where may have you picked up various exposures. I love this because we took a real deep dive on our patients. One, we have a filling out a full environmental toxicity history to be
Mhm.
able to actually see where exactly are these actual exposures. I love it. Female golfers that are at higher risk for breast cancers.
Mhm.
And so you see this again, and I've always said it's because of the herbicides, pesticides that are on the golf course. So you mentioned those herbicides and
Yes.
pesticides. We see this in our toxicology evaluations where you see this actual elevation. And again, at least 70, maybe sometimes even 95th percentile of some of these carcinogens coming from herbicides and pesticides. Yes, they're endocrine disruptors, which means they affect the actual, again, the way estrogens are responding to tissue. But guess what they're also doing? They're also suppressing immunity. They're also, again, many times there's also neurological issues with it as well. But what they're doing, and sometimes you have more headaches and things like that that are associated. But what you're also seeing is that they're carcinogenic. They actually cause gene mutations. So yes, carcinogens are a big part. But the other thing with this as well is that we also run infection panels.
Yes.
And many times when you think of tick-borne disease, you think that it's happening just at the East Coast. Oh, it's just happening in Pennsylvania or Connecticut, but this is where what we've seen is that this is the silent epidemic that's literally it's traversed our country, and that many times we haven't done a good job in our public health from identifying it. And now we see that again, you may have it in mom and it passes through utero into baby. And so now you see this correlation with mom to baby. You see it passing in sexual partners as well. And so you see these other routes of the way in which it travels.
Yeah.
Borrelia burgdorferi or Lyme, I'm speaking about. And you're mentioning all the other co-infections
Yes.
as well. You see that. You
And we
also
know
then
places like out here in Colorado, tick-borne relapsing fever is the top infection I see, and people aren't talking about that. So it's not considered Lyme endemic. But the truth is, you and I know Texas, Utah, Colorado, Wyoming, probably even Arizona, at least for me, some of the top things I see. And it's just as damaging and dangerous as Borrelia burgdorferi is the tick-borne relapsing fever species, right?
That's exactly right. And so this is where we want to be aware. And,
Mhm.
and so I really want to make sure the people that you're talking to are aware of this.
Yes.
That yes, it actually, that these exposure patterns are across the country, and you don't have to just be in an endemic area in Pennsylvania and have a a tick
Right.
bite that have a bullseye rash. That's actually a very small subset of that population that actually has living in that area. Yes, it's definitely in that area, and you can have a rash, a bullseye rash, but you don't have to as well. And sometimes it presents a little differently.
Yeah.
Okay, so we know Borrelia was a Lyme disease is an oncogenic infection. Okay, where there's been data after data talking about its ability to be able to cause, specifically for the years it's been talked about as far as it causing B-cell lymphoma.
Yeah.
And I always like to say, think about it. It's where Lyme or these infections, if they're located in a tissue, it's going to cause It's going
Yeah.
to cause cancer in that
Inflammation.
area.
Mhm.
Lyme loves the lymph nodes, so it resides in the lymph nodes. So why does it cause lymphoma or lymph node cancers? Is because it resides in the lymph nodes. Okay, but Lyme or Borrelia does not like the blood very much. So it actually does not like blood. It doesn't reside in the bloodstream. That's why it can sometimes be falsely negative.
Mhm.
And it also evades immunity. It also
Yes.
suppresses immunity. Those are the telltale signs that it actually can trigger cancerous presentation, as you were just sharing in your story, but it loves tissue. So if it's in very poorly vascularized tissue, i.e., the breast, where it's actually residing, and it's creating these inflammatory patterns and immune suppressive patterns, then it starts to be able to create cellular changes.
Yeah.
And this is where you start to see this. Now, we've known this for years. Like I said, we've been doing this for 25 years, and we've been studying these cases. And with every patient that comes on in, we're treating, again, looking at these root causes for various carcinogens or chemical toxins. We look at mycotoxins or mold toxins, which are a big deal
Huge, aren't
as
they?
well. Many people don't realize this. I'll do a little aside. There's various mold toxins that they've developed in big pharmaceutical companies for pharmaceuticals to treat graft versus host disease in transplant patients to suppress the immune system.
Yeah,
Okay,
let me just
this
speak
is
to
what's
that really
happening. So this
quickly.
is happening. It's suppressing your immune system and my immune system if
Yeah.
it's present.
I I was just gonna say, I want to actually mention if you're out there and you've done a mycotoxin test and you have mycophenolic acid, that's the one Dr. Oertle is talking about. And this has
Correct.
been known, the pharmaceutical uses mycophenolic acid to create CellCept, which is, like you said, an organ transplant drug. But I wanted to actually mention that because a lot of people have the results and are like, oh my goodness, this is. So when I'm in a clinic with a patient and I see mycophenolic acid, we talk about this is massively immune suppressive and it will affect you if we don't clear it out. So I love,
Big pharma knows it. You need
yeah,
to be aware of it so that
yeah,
again, you know the severity of what this is actually causing to get it out of the system.
yes.
That's exactly right. But again, if this is present and this is a cluster of these, it's the body is so resilient. This is what I always like to say. The body is so resilient. So cancer doesn't just occur because your body is weak. There's usually a
Right.
cluster of things that are going on, not just over a short period of time, but over a long period of time. And this is where it doesn't just happen overnight.
Hmm.
It happens over the course of years,
Yeah.
sometimes multiple years, to be able to actually get to a point of this actually occurring. So if you can catch it before that, oh my goodness, what
Yeah.
a beautiful thing. But again, this is where when you're running that, the other thing that you have to run are these oncogenic infections.
Yes.
Lyme being one
Yeah.
of them. And when you do that, we've been seeing these correlations for years. And so I was so excited when it was an NIH paper that came on out. It was published in the European Journal of Microbial Immunology in 2024. And this was in March 2024, where it actually said evidence for the presence of Borrelia burgdorferi in invasive breast cancer tissues. They actually finally studied this and actually
Wow.
saw that it was present and it was
Yeah.
present. It was interesting. There's a couple of really interesting things. It's actually higher presence in lobular breast cancer than
Uh-huh.
in ductal breast cancer, but it's still present. It's about 20 to 25% of the time that you actually see that. That's interesting because that's
Yeah.
correlative of what we actually see in our clinical data as well. And then you actually saw something that was really interesting too, is that they actually showed that they actually found that it was correlated to inflammatory markers that were actually inflammatory chemokines, or again, chemical
Yeah.
markers that are actually stimulating inflammation. And so this is where you do see this in inflammation with Lyme disease, that's creating this chronic
Yes.
inflammatory responses. And so you see that this is the very thing that it's actually stimulating. And
Mhm.
those chemokines, they're inflammatory, and they're you can almost think about them as far as like growth factors. They start to be able to signal growth. So they're signaling growth, but what it's also doing is it's distracting the immune system from doing the job to be
Mhm.
able to actually kill the cancer. And so it's almost creating this
It's like a
signal
decoy,
flare to
right?
say,
Right.
you need to
Exactly.
check this out. Don't look at me
Yeah.
here. Well, I'm creating a lot of this inflammation, but don't look at actually killing me, the actual cancer and the
Yeah.
infection that's stimulating this disease disruption and mutation, if that makes sense. So
That makes perfect sense. And we know this this immune activation, which is at the core, like you said, you can often see autoimmune and immunosuppressive in the same patient, right? Which makes perfect sense because we often see autoimmunity as another factor of all these infections. What other, we mentioned HPV, we mentioned, are there other EBV, mycoplasma, CMV? Is there other, I mean, I'm sure you do a big panel, but can you just give us a landscape of what other infections are common oncogenic infections?
yeah, so we're always looking at H. pylori again, which is another again H. pylori is another spirochete, just
Yep.
like Borrelia. Again, it depends on where that H. pylori is. Maybe many times it's in the actual the stomach, so it's going to be very strong in your actual stomach cancers. Obviously, some of these others like the hepatitis B viruses and hepatitis C viruses that are going to cause hepatocellular carcinomas or your liver cancer. The big one that I'm seeing though all the time though is Epstein-Barr virus and
Yes.
cytomegalovirus. These two viruses that are actually so oncogenic, and yet nobody's actually looking at this either. Epstein-Barr virus is another one that's very strong research and correlative in the actual lymphomas in the
Mhm.
lymphatic system because that's where it resides.
Yes.
But again, you can see that significantly. The other thing that I'm always looking at too is central nervous system, gliomas and glioblastomas. You start to see this specifically in the cytomegalovirus aspects. And so that's where you want to be able to just see this correlative. But again, I want to be cautious. I like to run a lot of these infections because they're actually quite surprising as well. There will be infections that surprise you that are in tissue that
Yeah.
I never actually thought that it was going to be. I think this is important for us to be able to think about, because again, it's similar to now the data's coming out that a lot of head and neck, a
Mhm.
lot of esophagus cancers are HPV again. That's
Right.
HPV. If you didn't test that, we would never know it. And so this is where, yes, we know that, again, just with this dynamic of if HPV or human papillomavirus is in the actual that tissue in that mucous membranes and starts to build a home. And again, I always like to say this too, it usually starts because the immune system did not clear out HPV. If you
Yeah.
actually know kind of the regulations behind even screening for females for
Hmm.
HPV, you don't actually treat HPV if it's present in a
Right.
young female.
Yeah.
You just let it go, and it usually is self-limiting. You retest for it.
Yes.
All these young females are like, yeah, I've been to my gynecologist and I've had HPV, and I've been so young that they just said, are you sure I don't need to do anything about it? And they say, just come back and retest. Now, I always like to say there's things that you can do like vitamin D and
Yes.
zinc and these other things that are actually really
Human.
helpful or green tea extracts,
Mhm.
right? These are really helpful for the actual clearance of the actual virus.
Yeah.
You actually see that too, is that it's actually helpful to support the cancer as
Yes.
well that the actual infection is causing, because it's shutting down that signaling with the infection. And then you start to be able to slow down that growth and actually treat the cancer as well. But this is where, when you start to look at this, it's really critical. But I always like to say, don't let it just think about, I always like to be comprehensive in
Yeah.
the investigations, because this could be life-saving.
Yeah.
If you find what that root cause is, now you actually have a trigger, or you have a direction, and it may be one, it may be multiple, which many times it is. Because again, even that, like I said, if it's Borrelia and it's suppressing your immune system, well, guess what? Then you have a harder time fighting off Epstein-Barr virus
Yes.
or
Yes.
cytomegalovirus, which is in our environments. That they're secondary infections, or HPV, that your body just isn't clearing it on off. There's a reason that as we get older, the immune system starts to be able to not do as well. And so that's why you need help clearing out HPV when you get older,
Yeah.
instead of the young 20-year-old that can have HPV and yet they clear it on off normally. The other one that I always like to share, though, that is another infection that many people aren't aware of, specifically is due to lung cancer.
Yeah.
And so if you have actually non-smokers that develop lung cancer, I'm always looking to, it's called chlamydia pneumoniae. Now, this is not the sexually transmitted disease chlamydia. It's another infection in the chlamydia family, but this is oncogenic specifically to the lungs. And
Right.
so I always like to be able to look at that one too. It resides, it's difficult to treat,
Mhm.
or it doesn't clear out very easily. But again, that's one that is correlated strongly with lung cancers. So again, you want to be able to be comprehensive in these oncogenic infections when you're able to identify it, and when you get early diagnosed, or even if you're first diagnosed, take a look. If you've been diagnosed for a long time and you've actually been in this fight with oncology as well, then guess what? There's still time. Get a second opinion. I will tell you that this is one of these areas, right? If you've been undergoing, a battle with cancer, and you've been going through maybe chemotherapy and radiation as well, what are those doing to the immune system? Well, they
Immune
suppress the immune
suppressive.
system,
Mhm.
and then it starts to keep building this out of control system
Yeah.
that just keeps worsening and adds to your symptoms, adds to the side effects, and actually adds to disease mutation. We use chemotherapy too, but we actually we have methods to be able to get chemotherapy that is genetically targeted
Mhm.
to the actual cancer. And this is what the beauty of precision, right? I want to
Yeah.
make sure that there's evidence to support that the actual chemotherapy that we're going to select actually goes and just kills the cancer like I want it to, if we're going to give it at all. But we also have methods. This is what's really interesting too, that I know it's not on precision oncology as far as this goes, but we have methods that get chemotherapy higher to be able to be taken up by the tumors.
Yeah.
There's a really interesting
Like
thing that I'd
insulin
like to share.
potentiation or circadian
Well,
rhythm.
we do it with insulin. We do other things though as well, other medications that we pair depending upon the cancer type, because not all cancers take up insulin and sugar as
Yeah.
well. So you want to be able to actually design it around, it's not a one size fits all. You want to design it around the biochemistry of the patient. But insulin can be really good. Insulin's good because it increases, okay, so when you have sugar, I'm a diabetic, so I know this firsthand. When I have sugar, if I don't have insulin, my sugar rises. And the way that the body uses insulin is that it drives the sugar into cells.
Right.
And so cancer utilizes that mechanism. It's what goes on in a PET scan to be able to actually drive sugar into the cells. And so if you have some cancers that have more sugar receptor sites that take it up to drive it in, the other thing that it does too is that insulin is pro-inflammatory, and it also triggers growth phase of cancer cells. What does that do with an actual cancer cell? If you have unopposed insulin and it's triggering growth phase, then again, that's a bad thing. But if you're giving it with a chemotherapy, it can
Uh-huh.
actually trigger growth phase. And then the chemotherapy, it's turning on so that it's actually taking up the chemotherapy, what it's designed to do. So that can be helpful. But I always say this is that when it comes to regular standard of care chemotherapy, just think about this. It's really interesting. Some of the data is that only 5 to 7% of the actual chemotherapy gets taken up by the actual tumors. The rest of it is going to central nervous
Your
system,
rapidly
chemo
dividing
brain,
cells, right?
potentially the actual cardiovascular, if it's cardiotoxic, the GI tract. It's going to the bone marrow where you're producing immune cells. That's why the actual immune system suppresses. So 5 to 7% gets to the actual tumor. I'm thinking this is why we see such poor results when it comes to conventional chemotherapies. Yet it's not the chemotherapy's fault. There's good options for chemotherapy, but you got to use it intelligently. You know,
Mhm.
we have therapies where we actually go in and directly inject. We call it CIPI,
Mhm.
chemo immuno precision injections, where it's going directly to the tumors under interventional radiology guidance. This is where you can actually target those lesions, and now you're getting 95 to 100% absorption of those chemos. So now you can actually start to use lower rates. So
Yeah.
this is where when you start to be able to think intelligently, when you're saying, okay, let me actually use the chemos or the other non-chemotherapy, but still medications that have targets, or the natural agents that have targets, and start to direct it to where the tumors are at. And then you start to be able to take off the root causes and you treat those actual root causes, whether they're clearing out those carcinogens or you're killing off those oncogenic infections. Now you have a comprehensive treatment plan that is actually can be life-saving. And
Yeah.
we've taken people that have been referred to hospice and gotten them into complete disease remission. And it's just beautiful when you have the right targets. And so this is where it's important to have data. And unfortunately, in the conventional oncology world, the unfortunate truth is, and I don't care where you're going or what center of excellence you're going to, many times patients have an insufficient amount of data
Yeah.
in which they're making decisions off of. And so if you're a patient, I advocate you to get data.
Yeah.
Know, learn, get the actual information so that you can actually make a better medical decision that's a truly second opinion instead of just a one size fits all approach, because that's what the insurance company is going to be covering, or paying your oncologist or hospital system to be able to actually cover. I hope that makes sense. I hope I'm not offending you or offending any of your listeners, but this is the real world as far as how oncology actually unfortunately works out there.
No, this is great information. My listeners are always curious, and you have done such a great job of describing some of the things people may not be thinking about if they have a cancer diagnosis. And I think it's just really important, like you said, for people to be educated. Um, Kind of as we wrap up here, maybe rapid fire, what would you say would be the top five lifestyle or supplemental things that are really powerful? I know there's this huge range, right? Exercise, diet. What would you, if you had to just give top 3 to 5 things that are most powerful, what would that be?
All right. Well, there's some really empowering things that I think that everyone can do. One, I and this is where obesity and being overweight,
Yeah.
it causes cancer. And so this is where if you are obese or if you're overweight, again, lose the weight, because I would much rather you lose that weight and get to a good amount of BMI or waist circumference now before cancer hits, and then you have to change the diet up. So do the hard changes now and make it motivating again, because this is where it can make a big impact. Some of those actual things can actually reduce cancer diagnosis by like 40%. And it's no little thing. The other thing is that where does toxicities reside? They
Mhm.
reside in the
Yes,
fat. So
correct.
when we actually are able to lose that weight and get to a normal BMI with a good muscle mass, this is where you can actually be less toxic. So
Mhm.
that's one of my first things that I always
Love it.
advocate for. and that's going to give you anti-aging. It gives you good quality of life because it's also going to prevent against cardiovascular disease, dementia, all these things that we do not want in the or older years to be able to live in an anti-aging world. Okay, so that's the first thing. The other thing, get off the couch and actually exercise.
Mhm.
Absolutely one of the best things. One of the things that I always like to couch that with, though, is don't think you need to be able to join the gym and lift these huge weights or actually have to do all these strenuous exercises. I'm just talking about movement.
Yes.
6,000 to 10,000 steps a day will give you so much ability to be able to actually ward off disease and reduce cancer and stimulate immunity. It's amazing. Or get one of those little rebounders.
Uh-huh.
15 minutes a day of just a little trampoline actually stimulates immunity so
Yes.
well, and it actually drains the lymphatics as
Lymphatics,
well,
exactly.
which is so important. So I love that. Again, exercise. Make sure that you're developing a lifestyle of movement. And so whether that's walking and enjoying the outdoors or being able to get on a rebounder 15 minutes a day, that's amazing. And do the rebounder with your hands over the head because that
Yes.
also helps to just drain those lymphatics and increase the immunity. And then if you're a diabetic, control the sugars because diabetes also leads to cancers as well. And then what I'm also fascinated about, and again, we all know that again, cigarette smoke causes cancer, and so yeah, no, don't have cigarette smoke. I don't know if that needs to be said, but again, if you have it, don't start, or if you never smoked, don't start. But alcohol, okay, this is the other thing is that what's really interesting is that we're just seeing that alcohol really isn't helpful for anybody. And so this is where I do want to raise awareness because there's a lot on this as far as alcohol, even in moderate or
Yes.
small amounts, is still carcinogenic. It's
Mhm.
cancer causing. And
Yes.
so I like to be able to go still enjoy yourself. But why don't you do it with actually having, have a mocktail and be considerate about your actual, what's going into that mocktail. So it's not super
Yes.
sugary, or being able to enjoy yourself with your friends. But again, making sure that we're doing these things to not have, to not cause deficits that are absolutely against us. And I think there's not enough people talking about that. And it's so easy to say, well, yeah, enjoy and then just relax. But it really doesn't help. So if you have alcohol, get it out of the house, get
Yes.
have a mocktail, enjoy yourself, but you can do it in a healthy way. And so I certainly, those are at least a couple. I don't know how many I did,
I
but again,
am
those are,
so glad I love, 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 because so often, even in functional integrative medicine, we forget about movement. We forget about the basics. I could not be more delighted to hear you say, lose the weight, get moving, get rid of alcohol, get rid of cigarettes, get rid of any of those things that you have a choice. I love it because honestly, that is the most powerful medicine is starting there. And then all the rest is important. So I hope if you guys are listening, you have some new information to take, even if you're visiting a regular doctor. I mean, there's some things they can start to test. Tell us, Dr. Oertle, about your center and where can people find more about it? Where's the website? Give us a little place where we can find you.
yeah, so we're located in Scottsdale, Arizona, but you can find us at invita.com. www.invita.com is where you can go learn about the testimonials, learn about what we're doing. And certainly we have people ready to be able to take your calls or answer questions, all throughout the week. So
How exciting. And Evita is Envita, is that correct?
that's correct. envita.com.
Awesome. And if you guys are driving, in my show notes, I'll try to find that article if you could send me the Lyme, the one in 2024, and we'll include that in the notes because that's fascinating. I'm going to read that, and then all the links to the center. And Dr. Oertle, thank you. I know you had a really busy clinic day today, and I'm really glad that you could come on and share this information. It's so powerful. And thank you again for the work that you're doing in the world.
Thank you, Dr. Jill. I appreciate it.
Hey, everybody, thanks for joining me for another episode of Resiliency Radio with Dr. Oertle. I hope you found that information on infections and toxins and cancers as fascinating as I did. Hey, be sure and subscribe. We've now reached over 500,000 subscribers, and that's because thanks to you guys. This just allows us to reach more people, get great guests for the show, and stay up to date on the latest in functional and integrative medicine. So please do subscribe, comment if you have questions or comments, and hit the bell so that you'll be notified of future episodes. Also, if you've been around, you might have heard me mentioned, but I'm doing a retreat this spring. I've been looking far and wide for the best place to take you to enjoy luxury, basically just on the ocean front, luxurious time in Mexico. It's at Shao Wellness. And if you want more information, we have two groups, 5-day retreats, one beginning April 26th and another beginning April 30th. So I hope that you can join me for one of those. There are very limited spots. So if you are interested, you're going to want to sign up as soon as possible to secure your spot. I'll be probably doing this again in the fall. So you can always sign up to get notified if you want to know about those dates in the fall if this one doesn't work for you. So, as you guys know, there's new episodes coming out every week. You can find us on iTunes, Spotify, Stitcher, or on YouTube. And I look forward to seeing you again next week for another great episode.